House Leader, third party.
Thank you, Honourable Speaker. I'd like to begin, Honourable Speaker, just by commending the Minister of Health and the Provincial Health Officer for their steady guidance through the last 100 days, and I know that the people of BC are very grateful for their open and transparent communication on such an ongoing basis. Honourable Speaker, during this pandemic, we've seen outbreaks occur in many of our province's long-term care homes and assisted living facilities. 585 cases as of June 17th can be linked to those outbreaks, and heartbreakingly, 116 residents or patients have died of COVID-19. An important aspect of this tragedy is the part-time hours many frontline workers are hired for. This resulted in many employees, mostly women and visible minorities, working in multiple facilities to make ends meet, causing them unwittingly to spread the virus between multiple homes. I welcome the fact that the government has ordered employees to only work at one facility and provided a backstop for those who have suffered financial hardship as a result. The Premier has said that he, quote, thinks that you can anticipate that will be, in fact, you can be certain that will be the norm going forward, end quote. My question for you, Honourable Speaker, is to the Minister of Health. How will government ensure that employees are being paid a living wage so that they can afford to work at only one facility? And when can we expect to see legislation that will make these changes truly permanent?
Minister of Health.
Thank you very much, Honourable Speaker. Thank you to the member for her question. The single site order that was put in place pursuant to the medical health officer or the provincial health officer's orders included a very significant change that made it happen. This involved, by the way, 501 facilities and 48,795 employees working in those facilities, 8,800 of whom worked at multiple sites. So what's happened? All 501 right now, all 501 have single site orders in place. All 8,874 employees have been assigned to a single site. In addition, all of them, not just the 8,874 affected by the single site order, are seeing a top up to their wages to bring them up to HEA-BC negotiated levels. And those who have a particular pay grade go to the highest pay grade if they're at multiple sites. So these are significant changes. I want to say that we made this happen by making those investments, by supporting the process. Other provinces have talked about this. The British Columbia, with the support of all political parties, have acted. And I want to thank everyone involved in healthcare who've made it happen. Those orders are going to be in place for some time and give us the opportunity to work on the future. But I have to say that it has been the contribution of unions such as the HEU, of employers such as those represented by Denominational Health and the BC Care Providers Association, who've helped make it happen. This has been a Team BC approach, and it has to continue to be a Team BC approach to ensure that workers are protected, but most importantly, those people living in long-term care are given the care that they need and that they deserve.
House Leader, third party on a supplemental.
Thank you, Honourable Speaker, and thank you to the Minister for that response. Currently, BC spends $1.3 billion per year contracting for-profit companies and not-for-profit societies to operate 2/3 of the province's long-term care beds. The not-for-profit sector spends almost $10,000 or 24% more per resident per year than the for-profit sectors on direct care. One of the biggest reasons for this disparity is the for-profit sector underpays their care aid staff by as much as 28% compared to the industry standard. Not only that, according to the latest report from the BC Seniors Advocate, the for-profit sector failed to deliver 207,000 hours of funded care, which means over 200,000 hours of care paid for with public funds was never provided. In contrast, the not-for-profit sector provided every hour they were funded to deliver, and then 80,000 hours more. My question for you, Honourable Speaker, is to the Minister of Health. On March 4th, 2020, the Minister said in relation to for-profit companies, and I quote, "They have the responsibility to provide care. We have the responsibility to regulate, and we will," end quote. When and how will for-profit companies be held to these responsibilities?
Minister of Health.
Well, thank you very much. Thank you very much for the supplementary question. I think you'll note that the report of the Seniors Advocate was based on the fiscal year 2017-18. Since then, a number of changes have occurred that are important. Unanimously in this House, members supported Bill 47, which got rid of Bills 29 and 94 and empowered healthcare workers in a way that hadn't happened before, gave them the same rights as other workers in society. In addition, since that time, we've significantly increased funded care hours, particularly for those two sectors, particularly for the for-profit and not-for-profit sectors who provide public beds in BC, such that at the end of this year, we're going to move from 3.1 care hours per resident day to 3.37 care hours per resident day. And even more important than that, 75 care homes, all private or not-for-profit, were funded at under 2.9 at that time, care hours per resident day. Just to put that in context, that is more than 3 hours per week per resident of direct care under provincial standard. There were 75 such care homes. Now there are 0. And we've also brought in place, again, working with a Team BC approach, with new mechanisms both to enforce contracts and a new web-based tool, which will be moving to this summer to assist everybody in ensuring that the hours provided and the funding provided by government are in fact delivered by providers. We're doing this by working together. This is a made in BC approach. It involves not-for-profit, it involves for-profit, it involves associations of employers and unions. And we are moving forward to improve seniors care in this province. And those changes, Bill 47, the hiring of new care aides, the increase in care standards, have made a significant difference in BC as we've gone through the COVID-19 pandemic.